AnginaX AI, I warmly welcome all of you. In a landmark initiative poised to perform how India confronts heart disease, its leading cause of death, Jaslok Hospital has partnered with AnginaX AI, India's first licensed AI doctor assistant in cardiology. Together, they have launched Maharashtra's first operational AI-powered cardiovascular prevention model. So, to know more about it, let me first invite Mr. Naman Gosalia, the founder of AnginaX AI, to speak about what it is all about. Thank you. Over to you, Mr. Naman.
Thank you, Josh. First of all, thank you all of you guys for coming here and covering one of the biggest news of Maharashtra, especially in healthcare. I would like to first mention about our leaders, clinical leaders here who are sitting here, and because of them, I think we are starting this AI prevention model in Jaslok. But before talking about what is the product, how it is going to happen, it's important to talk about what are the challenges we have right now. So if you see currently, one of the core challenges that we have in Indian medical system is it's symptom-driven approach. Patients do not go to doctor unless they have symptoms. So doctors are trained and expected to treat those symptoms instead of, and then they have to relieve those symptoms quickly. But overall, we're missing out the underlying conditions. So prevention is extremely important for everybody, and AnginaX is leading that, working with Jaslok partnering with AnginaX on specifically AI-driven cardiology prevention model, Maharashtra's first model, and I would like to talk about that later on, but I would like Dr. A.B. Mehta sir, who is leading this effort, and he should be able to talk about that program as well. Thank you.
Thanks, Naman. So let me invite the legend in the field of cardiology, who has been in the field for over 53 years now, who needs no introduction, Padma Bhushan Dr. A.B. Mehta, the Director of Cardiology at Jaslok Hospital. Sir, can we have a few words from you?
Thank you. Naman gave you some background. I would say the absence of symptoms is not the same as absence of disease. Number of times I've seen that the people get the startling news that they have hypertension or diabetes when they get their insurance checkup done. So therefore, we realize that both hypertension and diabetes can continue to damage your health without your knowledge, uninterrupted. Can we prevent? Certainly not prevent, at least postpone by controlling diabetes and hypertension, provided you know it. When we talked about sudden cardiac death, and then we came to know that a lot of people, especially startlingly more in the recent past, that one Dr. Prasanna Naidis, the director of cardiology at KEM Hospital, dropped dead soon after the coming back from gym. I don't remember the name, but 23-year-old girl, while she was performing dance on the stage, collapsed, and she was no more. This unfortunately happens while the people are at the zenith of their career. They have young children, they are about anything between 30 and 45. So this is disaster, big calamity to the family. This problem is very enigmatic. The problem is that the patients do not come to a doctor until they have symptoms. Even doctor may fail to detect any abnormality because most of the tests are coming normal in them, including even a stress test. The reason is simple. The blocks in the coronary artery, which is made up of fatty acids and cholesterol, exist into the coronary arteries, and then there are about 30-40% they are not detectable, neither by the ancillary medical investigation nor patient notices any symptom. What happens is due to sudden stress, like external stress or internal stress. By the external stress, I would say rigorous exercise, which raises the blood pressure and which raises the pulse rate to a very high level, and that plaque, which is only 30-40%, and if it is covered by a thin membrane or a thin cap, it ruptures. When it ruptures, this plaque, which is only 30-40%, over a period of minutes or hours, becomes 100%. When it becomes 100%, it precipitates heart attack. No tissue in the body can remain alive without blood. So that's supposed to have insured. 50% of the people who sustain heart attack are unable to reach to the hospital because of sudden death. Now, 65% of the patients who get admitted in our hospital with heart attack did not have any symptoms whatsoever prior to their admission to the hospital. So then I think it becomes very, very important that we find out and weed out from the society who are those individuals who are at a higher risk of developing such sudden catastrophe. If we come to know that these are the people who are at a high risk of developing sudden heart attack and sudden cardiac death, then I think we can intensively treat them, and in vast majority, if not all, we may be able to successfully avoid precipitation of heart attack in them. We are not finding a single effective program in Maharashtra state, and it's a shame that the medical profession has not paid as much attention as it ought to have given to this aspect of health. Prevention is a very important aspect of healthcare, and prevention is a very important aspect of medicine. We don't have to necessarily treat diseases, we have to prevent diseases. And we want to popularize this concept. We want to encourage people to come to us, irrespective of their symptoms or no symptoms, and give us an opportunity to find out, evaluate them, so that we can be helpful in preventing such catastrophe. And this is entirely the aim and objective of this program which we are going to launch. This is what I believe I would say.